Okay, let's turn back to the issue of health circumstances for Black communities. I talked recently with State Representative Liz Miranda, and she was severely impacted by COVID-19. Not only her, but a large portion of her family. Take a listen.
I have been working so hard that in the last 3 months, I haven't really taken stock of the way that COVID ravaged my family. I was sick for a week. I could not get up for 4 days. My grandmother has been in my care, my family's care, for 10 years. And the fact that I lost her on April 17th, a week before we all found out we were sick, and she had gotten 2 negative reports of COVID. And so we felt like we were safe. My family is still very fearful of COVID. My community is still disproportionately impacted. Black and brown people are dying at a rate of 42% in comparison to other members of Boston.
What do you think is the main issue, the main reason behind this problem?
It is structural racism and the poverty it grew. I can't begin to tell you that the lack of access to care, the response out of the White House was woefully insignificant and actually, I would say, quite criminal. Testing in our community came late. There's an issue around language access. Folks did not receive the materials that they need in the language, their first languages. My district, the Fifth Suffolk, beloved Fifth Suffolk district, is 52% foreign born. People speak Vietnamese, Spanish, and Cape Verdean Creole and Haitian Creole. They did not receive that information. So I would say it's definitely structural racism. I believe in science, and so I'm not going to have any conspiracy theories today. But if you can talk about how poverty has created a life expectancy drop in Roxbury of 33 years, that in comparison to our friends in the Back Bay tells you something. It tells you that regardless of my economic status, I have a degree from Wellesley. I feel like I'm a well-educated woman. I am a state representative, and this disease still got to me and my family. And I took every precaution.
Dr. James, you're on the front lines at the Boston Medical Center. You talked earlier about seeing the same people for the same problems over and over again. It seems as if we've been focusing too much in the medical community on the disease rather than solving the overall problem, no?
Right. No, absolutely right. I mean, doctors are taught to focus on disease. That's what they're taught. So they focus on whatever's sitting in front of them. And they're chasing that. But again, patients are chasing life. And the two never align. And what that just leads to is just perpetual poor health outcomes. And by the way, high cost. I will say that hospitals have begun to try to think outside the box a little bit to disrupt some paradigms. Particularly when, people are saying things like, some people have said stuff like stay in your lane or whatever. But hospitals, for example, three hospitals in the city leveraged a policy around the termination of need policy that says when you do construction on your facility, that you have to give 5% of the total cost to the community. And when we did a campus redesign, we asked if we could commit our obligation to different types of housing initiatives. And the state approved it. And what that did was also paved the way for other healthcare systems in the city to do that. And together we invested in housing, unstable housing. We created an innovative stable housing initiative. We were also able to invest in a housing unit over, it's called Bartlett Place. And the reason I'm bringing it up is because that obligation translated to 321 units of new mixed income housing, some to own, as a matter of fact, and some to rent. 70% of the construction workers there coming from the community, which was optically a beautiful thing to see at the ribbon cutting. And also getting a grocery store to come there and subsidize the units above it and hire people. So we've tried to step outside the box in that way. And also working with at least one organization we know that works with people who live in public housing to break that cycle that perpetual multi-generational cycle of public housing where people wind up being trapped, because of, this cliff effect. And this organization we work with actually will, if the housing authorities agree, they will work with residents, and they are able to not turn down jobs, which people do, and not turn down raises, which people do, because they don't want to lose their housing. They can actually earn more, and that extra money actually goes into escrow for home ownership. And also it goes into escrow for education for your kids, because everyone in your house is eligible for it. And so, we're not just standing idly, just watching, standing by watching these things happen, because it's like, it's impossible. You can't accept it, as a healthcare provider, to watch this. You wonder what you're doing, when you see these things happening over and over again.
And doctor, if I can get you to address this question quickly from Facebook, asking about the impact of chronic stress of living in a racist society.
Yeah, I don't know anybody who's affected by that, including myself, so, we actually, I tell you something, the patients will tell us that all the time. If you engage with them and talk to them, we've studied them on various different things, and what they would say are things like, you know what, I would love to learn more about this or that if I could just address the stress. And I would say that stress and social isolation and those types of things, that is probably the number one thing on the list for people who come in our hospital, because they're so worried about so many things, and which is another reason
Adrian,
why.
Adrian, are you hearing that as well?
Oh yeah, absolutely. I mean, all of these things are drivers of poor health. I mean, I don't think there's any secret to that.
Yeah.
Absolutely. I also want to add to that. I think this is also an opportunity for people to understand that this particular issue is something that impacts Black folk regardless of who you are, or what your job is, how much you earn, how many degrees you have. Being Black in America is stressful. So what does that mean? It means, getting up in the morning, going to work. Very few of us go into workplaces where we could just show up and bring our full selves. Most of us wake up, we go into workplaces where we have to prepare ourselves to engage in environments that are predominantly white in culture, and expect us to conform to that culture. It's a constant, every minute, every hour, thinking about how you're moving, how you respond to an email, how you show up to a meeting. All of that that's weight. That's weight that, quite frankly, many of our white colleagues do not have. And it's something that impacts many of us. It impacts parents. I was the chief equity officer for the Boston Public Schools for 2 years. And we would consistently hear from parents, Black parents, about how they had to really think about how they showed up in school buildings so that school leaders would not perceive them as a threat. That lends itself to significant stress. And as Dr. James noted, that, of course, is a through line to, disparate impact on health outcomes. But none of us are immune to that.
Well, our conversation has really been focused on what's going on in Boston locally, but let's zoom out a bit to take a look at the national picture, at least according to the CDC and the latest data from the CDC. Black African-American people make up 19.9% of known COVID-19 cases in the U.S. Black African-American people make up 23.3% of known COVID-19 deaths in the U.S. And of course, the stark reality is that Black African-Americans make up only 13.4% of the U.S. population. Now, we interviewed Dr. Leandris LaBerge. She's the Associate Director of Minority Health and Health Equity at the CDC. She's also a medical anthropologist, and her really sole job is examining health equity and health equity issues in this country. She interprets the data from a humanistic point of view and says one of the things that she worries about is the stigma of being a COVID victim and a person of color. Take a listen.
Our society values people who are young, who are healthy, who are fit, who are fast. And so when we have a condition or multiple chronic conditions that would present us as not being part of the desired group, I think then that helps to add toward a code of silence, if you will. And so the way we handle conditions like COVID-19, I think particularly from a public health standpoint, is going to be very important so that people, if they happen to test positive for no reason of their own, it wasn't like they went out and did something and contracted COVID-19, other than what we've, not following the mitigation strategies that we talk about all the time. But we want them to be able to say, yeah, I had that. This is what it was like. This is how you can protect yourself. And that it not be something to be ashamed of. I think it's the shaming and the victimization that comes with certain conditions. And that could happen if we're not careful with COVID-19. Well, we work closely with the White House, with the Department of Health and Human Services, and I think we all share a commitment for improving the population health outcomes of our nation.
Adrian, I was having a conversation with someone I know about this issue of the stigma. They are recovering from COVID-19, and in addition to putting up with, all the lingering effects of it, they also are nervous about telling anyone that they had COVID-19 because they do feel this stigma. What are your thoughts on that? Is this sort of general fear right now, or is this a real issue and potentially more devastating for Black and Brown communities?
I think it is a real issue, and I think people do worry about the stigma. But before we get to that, I want to say something about the CDC and the White House and the federal government's response to COVID, which I think has been bluntly, thoroughly racist. I don't think there's any evidence that President Trump has shown any concern about how this affects communities of color. So, having gotten that off of my chest, yes, I do think there is
Right.
stigma and people worry about it, but I have a greater concern than that, and that's with the federal government and its response as it concerns COVID and communities of color.
And anyone else want the reaction to the comments from the CDC?
I agree with Adrian. I do think there is I trust that the folks at the CDC, are following the science. That being said, we have to be very honest about the fact that we have not, as a nation, handled this crisis well at all, with no national mitigation strategy. And in fact, some might argue policies that, to Adrian's point, were meant to target Black and Brown communities in a way to make us less safe. And what I mean by that is, we're seeing it play out now in Atlanta, Georgia, with Mayor Bottoms being challenged by Governor Kemp on her masking policy, on her masking recommendations. We know that masking and face coverings save lives. And we know that, the data is very clear that while COVID-19 does not discriminate as a disease, it does have an adverse impact on the Black community. So when there are strategies that are put in place that we know work, that the science and the medicine say work, to have the administration really reject those practices is problematic, and it certainly does not demonstrate leadership that is mindful of all of us here in the Commonwealth, let alone Black folk.